Welcome to Section 7 of Public Health Sciences. In this video, we'll discuss healthcare delivery. Let's get started. Here's an overview slide of what we'll be discussing. The first topic we'll discuss is disease prevention. There are four main types of disease prevention. The idea of prevention can be broken down into several categories, including primary, secondary, tertiary, and quaternary. Primary prevention makes sense because you're actually preventing a disease from occurring in the first place. Vaccination is a perfect example of this. Hand washing is another. Secondary prevention has to do with screening to catch a disease early. A pap smear is a good example of this because you're screening for a disease but not necessarily preventing it from developing. You're trying to find the disease while it's asymptomatic, so you can treat it early in its course rather than waiting until it's much more difficult to treat. Tertiary prevention just means treating a disease to reduce complications and prevent further sequelae of the disease. In the example of a woman who has metastatic cervical cancer because she failed to get the HPV vaccine as a primary prevention and didn't have regular pap smears as secondary screening, chemotherapy would qualify as a tertiary prevention. Quaternary prevention is less important, but basically means protecting a patient from potential harm of unnecessary intervention. An example of this would be to not perform a CT scan on a young child because of the potential harm associated with the radiation. Okay, now that we've talked about disease prevention, let's move on to insurance. I think health insurance is easiest to think about by grouping the various plans as I've done in this table. The first two, Health Maintenance Organizations, or HMO, and Point of Service, or POS, both require a primary care provider. So for PCP required, you can see that it says yes. Patients within these plans also need a referral from their PCP in order to see specialists. So must have a referral to see specialists. The major difference between these two plans is that with an HMO, you're restricted to seeing doctors in your network, or in other words, doctors that have an agreement with HMO. With POS, patients within this plan can see doctors out of network, although doing so will likely be at a higher cost. The second two insurance plans do not require a PCP. Preferred Provider Organizations, or PPO, and Exclusive Provider Organizations, or EPO, allow a patient to see any doctor in the network without requiring a referral by a PCP. The difference between the two is that PPOs allow patients to see doctors outside of network, or in other words, they have an open network, whereas EPO plans do not reimburse for doctors outside of a very limited network. One last thought, generally speaking, HMO and EPO plans are cheaper, with PPO and POS plans being more expensive. This can get a bit complicated, but these are the basics that you'll need to know about these plans for step one. All right, let's do a quick practice question before moving on. You are working on a research project with the radiology department to develop a new screening test for lung cancer that would detect it with greater accuracy earlier in its course. The test does occasionally yield false positive results, leading to unnecessary biopsy and treatment. However, your research principal investigator hopes that implementing this test will give physicians a tool that they can use to more effectively counsel their patients to quit smoking. What type of prevention would this screening test constitute? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. Or D. Quaternary prevention. All right, this question has a couple of distractors to complicate the picture, but at its core, the screening test is an attempt to detect a disease early on and prevent it from getting worse. One of the distractors in this STEM is in the form of the research PI, hoping that the test will allow physicians to counsel patients to quit smoking more effectively. Having patients quit smoking is a form of primary prevention, as it prevents the negative effects of smoking. Another potential distractor is that the test leads to some unnecessary treatment. So it could be argued that eliminating the test would be a form of quaternary prevention, helping to keep patients from experiencing harm caused by the medical system. However, the test proposed is a type of secondary prevention because it's a screening test. Therefore, the correct answer is B, secondary prevention. Okay, let's move on with the lecture. Our next topic to cover is payment models. There are several different payment models for healthcare that you need to be familiar with for step one. The first model is the traditional fee-for-service model. This is pretty self-explanatory and entails either the patient or insurance company being charged separately for every service rendered. Each visit, procedure, or medication would incur its own fee. Recently, it has been criticized for providing perverse incentives for doctors to order more tests and imaging and perform more procedures as a way to maximize profits. The second is a bundled payment. This is where a healthcare organization receives a certain amount of money from an insurance company for a set period of time for all of the patients they are responsible for caring for. This is regardless of how much these patients use the healthcare system. This bundle of money is then divided amongst the physicians and facilities as the healthcare organization sees fit. Capitation is similar to bundled payments, except the money is tied to each individual patient rather than a group of patients. This means that the doctor gets a set payment for each patient he or she accepts care of, regardless of how much care they receive. This amount does not change regardless of how much the patient uses the healthcare system. Because the hospital only receives a certain amount of money per patient, they are encouraged to keep their patients healthy and focus more on preventative care. By providing, for example, adequate vaccination, screening, and other preventative measures, patients are more likely to stay out of the hospital, thereby allowing the hospital to keep more of the money instead of using it on surgeries and other expensive interventions for their patients. A global payment model entails paying a provider a set amount for a procedure and all of the visits and care related to that procedure. This is most commonly employed for elective surgeries where the pre- and post-operative care does not cost extra. The procedure and everything associated with it are all part of the same payment. Any additional costs incurred by complications related to the procedure are covered by the provider. All right, now let's discuss Medicare. Medicare is a federally sponsored health insurance program. Anyone over 65 years old or with end-stage renal disease on dialysis qualify for insurance under Medicare. Some people under 65 who are disabled and have been on disability benefits for over 2 years also qualify. There are 4 parts to Medicare labeled A, B, C, and D. Part A covers hospital and hospice care. Part B covers basic medical bills, such as doctor's office visits and procedures. Think of B for bills. Part C is a combination of A and B that is handled by third-party private insurers that some people on Medicare sign up for. Think of C for combo. In other words, A and B are combined. This part represents a public-private enterprise that allows other private insurers to handle a patient's Medicare payouts. Part D is prescription drugs, which is easy to remember because it starts with the letter D. Our next topic covers Medicaid. Medicaid is like Medicare, except usually it's much less generous and fewer providers are willing to see Medicaid patients because it doesn't reimburse as well. While requirements vary by state, Medicaid generally covers patients under a certain income level, often below the poverty line. It also covers pregnant patients and provides coverage for children. All right, let's try another practice question before moving on. A 76-year-old patient on Medicare is admitted to the hospital for treatment of a malignant lung adenocarcinoma. He is initiated on chemotherapy and remains in the hospital for 2 weeks. He does not work with a private insurer. Under what part of Medicare will his chemotherapy drugs be covered? A, Part A, B, Part B, C, Part C, or D, Part D? All right, although the patient is being treated with chemotherapy drugs, which you were told are covered under Medicare Part D, all hospital inpatient care is covered under Medicare Part A. Just remember, anything that has to do with hospital or hospice, including drugs used inpatient, is covered by Part A. So A, Part A is the correct answer. B is incorrect because Part B of Medicare covers Medicare bills, such as doctor's office visits and procedures, not hospital expenses. C is incorrect because Part C of Medicare is a combination of Parts A and B, handled by private insurance, which the question specifically states is not the case of this patient. D is incorrect because although chemotherapy drugs are drugs, hospital expenses are all covered by Part A of Medicare. Okay, moving on, now let's talk about hospice. Hospice is an interesting aspect of healthcare delivery in the sense that it's not focused on treatment or cure of disease. Rather, it's focused on providing comfort and palliation for patients at the end of their life. It can be administered either at home or in a care facility, and patients generally qualify for it once their prognosis is less than 6 months of life or some other similar cutoff. Hospice generally involves the liberal use of controlled substances, such as opioids, sedatives, and anxiolytics to ensure comfort. Side effects such as respiratory depression are tolerated in hospice, and occasionally these medications do lead to an earlier death. However, this does not qualify as physician-assisted suicide. Okay, moving on, now let's talk about common causes of death. I wouldn't worry too much about memorizing each and every one of these, since you're unlikely to be asked about anything as specific as, what is the most common cause of death for people in this demographic? However, I've listed them here for you to review. I'll point out a few that I think are easier to remember and a little more relevant. First, note that infants are likely to die from exactly what you'd expect: birth defects, complications of preterm birth, and sudden infant death syndrome, or SIDS. Next, note that accidents are the leading cause of death from ages 1 to 44. Finally, cancer and heart disease switch off between first and second place in terms of killers of middle-aged and elderly people. Those are the key takeaways from this section. Last but not least, let's discuss conditions with frequent hospital readmissions. This section highlights the disorders that are most likely to require readmission to the hospital within 30 days of discharge in each category of insurance coverage. This is a relevant metric simply because it indicates the highest burden of disease for patients with each type of insurance. This isn't super high yield, and the culprits here are pretty intuitive, so we'll just briefly go over them. For the older patients on Medicare, congestive heart failure or CHF, sepsis, and pneumonia are the 3 most common causes of readmission. Patients on Medicaid and uninsured patients constitute a similar demographic, so it makes sense that the causes of their readmission are similar. As you can see, both mood disorders as well as diabetes are pretty common for these individuals. The only big difference is that uninsured patients also have alcohol-related disorders on the list, while Medicaid patients have schizophrenia and psychosis on the list. Finally, privately insured patients are most commonly readmitted for chemotherapy maintenance, followed by mood disorders again, and then complications from surgical procedures. All right, now that we've covered the information, let's review with another question. A 92-year-old patient is started on home hospice. Prior to this, an end-of-life care discussion with her family is conducted wherein she expresses a desire to be lucid and able to communicate with the family as long as possible. About 2 months into hospice care, she has waxing and waning levels of consciousness and is complaining of significant pain. She is already on a moderately high dose of an opioid medication. Her adult son is at the bedside and requests pain medication to help ease his mother's pain. What is the best course of action? A. Administer a higher dose of morphine. B. Withhold pain medication to help sharpen the patient's mental status. C. Initiate delirium protocol and eliminate unnecessary medications. Or D. Administer naloxone as the patient is likely overdosed on opioids. All right, the key to answering this question is remembering that the purpose of hospice is to ensure the comfort of the patient. Although the patient expressed a desire to remain lucid as long as possible, treating the pain is the highest priority. Mental status would be expected to deteriorate at the end of life, and the fact that this patient is on hospice means that this is likely an expected development. So the correct answer is A. Administer a higher dose of morphine. B is incorrect because although the patient expressed a desire to remain as lucid as possible, the primary goal of hospice is to provide for maximum comfort for this patient. Therefore, it would be inappropriate to withhold pain medication in this instance. C is incorrect because even if the patient is suffering from delirium, she is nearing the end of her life and you should prioritize her pain treatment above all else. D is incorrect because the patient is not clearly overdosed on opioids and is continuing to complain of significant pain, which should be treated. So again, the correct answer is A. Administer a higher dose of morphine. And with that, we've covered everything you need to know about healthcare delivery.